this is Dr. Do again. This video is continuously the systemic approach of medicine. Basically, this is talk about the different structure, either from invisible major compounds to the invisible cells, and then to the visible tissues. I have talked about diseases associated with different tissues, such as the epithelia or the connective tissue. Just use some example to connect it together. And move on to the muscular tissue. Actually, last time from previous video, I talked about the 3 types of muscles, like skeletal muscle and associated diseases. It's so obvious. And also talk about the smooth muscle, associated diseases. I talk about the major locations you can find smooth muscles are the digestive system, either stomach or the small intestine, large intestine. I talk about the ulcers and also the other serious conditions like perforations through the walls. And there's another important place for the smooth muscle to be found in the body. Actually, is in the blood vessels, particularly the arteries. Of course, there's a in the veins. There's also some, but very minimal. However, in the arteries, the smooth muscle function significantly functions to constrict or to dilate, to affiliate with the blood pressure blood pressure regulation, and also to serve as a target organ of regulate blood pressure from some hormones. Those hormones function as these blood vessels to constrict the smooth muscle, to make it smaller, or to dilate it, make it wider, to improve the perfusion. So this is the example for this. For example, during the acute hemorrhage, if the hemorrhage amount more than 10% of the total blood volume, then the first reaction is the constriction of the small arteries from the peripheral organs, which means not quite significant compared to the heart, to lung, to the brain. So those like skin muscles, those small blood vessels in the skin or in the muscle start to constrict, so which means to close those spaces, and the blood will circulate among the important internal organs like the kidney. Actually, kidney blood vessel also constricted to the brain, to the heart. That's what is the small arteries regulated by the hormones and acting through the smooth muscles contraction to constrict blood vessels, to reserve the perfusion for the major organs like the heart and the brain. So this is about the small blood vessels and the smooth muscle. You can find that in that area. And during the acute ischemic or hemorrhage, like for example, the kidney also, the small blood vessels, small arterioles in the kidney also constricted. So the first response, decrease urine, increase the peripheral resistance, and raise up the pressure to perfuse the important organs like the heart and the brain. So this is one of the example where you can find this smooth muscle in addition to the digestive system. And also associated with disease, this smooth muscle disease, actually the blood arterial sclerosis. Those sclerotic inflammation plaque, for example, start from the inflammation, thickening of the blood, or minor injury of the endothelial cells, and then formed the inflammation and the plaque. Those plaques extended along the blood vessel wall, and to thicken the blood vessel wall, to decrease the flexibility, and to increase blood pressure, of course, so the smooth muscle cannot function normal, to dilate the blood vessel, decrease blood pressure. So that's one of the mechanisms of hypertension. So this is about the smooth muscle, where you can find it in addition to the digestive system and associated with diseases. The other important muscular tissue is the heart, the cardio-muscular tissue, the muscle you found in the heart, which is called cardiomyopathy, the associated disease, or either ischemic, that's the notorious myocardial infarction caused by the ischemia, And this ischemia actually is, you probably know it, the ischemia caused by the coronary artery sclerosis because of this plaque and inflammation to thicken the blood vessel wall on the coronary artery, which the main artery supply the heart itself. So during this process, of course, the cardiocyte, which means the muscular cells in the heart, undergoing the inflammation and cannot regenerate. So only healed by the scar. So that's why either the myocardial infarction recovered, but still there's a scar there with limited function of the heart, particularly important part, the left ventricle or the septum, still in with the risk factor there for the future heart failure or any associated disease of the heart. So this is the cardiomyopathy, or and also another disease occurring in this cardiomyocytes are the inflammation, or either the cardiomyocytes, which means that the inflammation of the cardiac muscle. I already talked about it. Usually it occurs after the viral infection, or just the idiopathic cardiomyopathy, which means enlargement of the muscle cells from the heart, or the heart chamber walls getting thickened. So this is about a disease associated with the muscles I can think of. And some of them probably serious, some of them probably just common. I think in this case, I mentioned the conditions are quite serious, associated with the mechanism. For example, the injury, acute trauma for the skeletal muscle, or the perforation from either in the stomach or small intestine, perforate the wall of the structures of the organs, the hollow organs, actually, that's what they called. And also the heart, if the cardiomyopathy or cardiomyopathy or the cardiomyoinfarction, etc. These are all the serious conditions, or the blood vessel constriction from the small arteries during the acute hemorrhage cause this constriction, which serving good purpose, compensate to improve the perfusion of the important organ. I think it's quite confusing, but in order to understand better, probably I did not explain quite clear, but you can search the acute ischemic from the loss of volume. You can search that, you definitely can find the body regulate this through the hormones, the angiotensin, the epinephrine, constrict the peripheral blood vessel, improve the perfusion of the heart and the brain. So that is, if you're interested, you can search acute loss of volume, what the response of the body. So this is about the muscular tissue associated diseases, continuously from previous video, and some of them I think majority of those diseases I have mentioned on my previous streaming videos. So if you're not clear, or if I did not make it clear, you can definitely search, and I hope that it reminds you or help you or trigger your interest to search more. And thank you for watching. I will see you next time.